Welcome to another episode of Smileys in the Air, your oral health and prevention podcast. I'm Sosa da Costa, and today with me I have the head of the Laboratory of Microbiology of the Department of Periodontology at the University of Bern, Switzerland, Professor Eick. How are you today?
I'm fine.
So why you are here is that in 2021 we launched a book, Oral Biofilms, that was under your editorship. So why this book about oral biofilms?
Because oral biofilms play an important role. Nobody knows in total about biofilms, and I think it is an amazing topic. How bacteria behave in a biofilm, what we can do against bacteria in biofilm, and also what is around a biofilm. What is a biofilm itself?
For me, it was a really interesting reading. I have my book signed by Professor Lucy, actually. So I need to be...
I can also sign it.
Exactly. That was what I was thinking. But in a simple way, for listeners that don't understand what it is, microbiome or even oral biofilm, what is it?
Oh, this is a complicated question. If you are talking about microbiome or about biofilm. Microbiome covers nearly everything. It covers the total amount of microorganisms we live with, and it's not only the microorganisms, this is microbiota, is how they interact with the environment, what they are doing. This is microbiome. And the biofilm, this is an accumulation of microorganisms on certain surfaces. It is not that they are free-floating, they are adherent to surfaces. And this might be a tooth, it might be an epithelium layer, or it might be also some artificial compound, like an implant or a restorative material or something else.
What I like in the book is that in the different chapters, you talk about the difference of oral biofilm in different areas of the mouth. So yes. When we are talking, and we talk a lot about it, when we have an artificial compound, so when we have an implant, it's difficult to remove the biofilm by itself at home. So what kind of role can the biofilm have on the artificial components?
Oh, it has the same role as if you go to the periodontal pocket. It is if it is in a region where it not should be, then it might be dangerous. It might cause inflammation and tissue destruction if it is for a longer time, and definitely we should try to remove the biofilm from this area.
What is the best way to remove the biofilm from this area?
At the moment, the only thing that really works is to remove it mechanically by different purposes. It depends. If you are talking with people, I think the curette is not anymore the best option. It might be, in addition, something. It might be ultrasound that works nicely. It might be air polishing. And maybe what I heard last time, that it might be also a combination of both. Because air polishing, it does not remove the calculus for that.
Yeah.
And in part, it might be also difficult to reach a very distant region. But for the surface, it's a good option, I think.
Yeah, I'm a defender of the combination.
Yes.
To have air flowing plus the piezo.
Yes, I think the combination is the best.
Yeah. And we always talk about dysbiotic biofilm, symbiotic biofilm. For the listeners, again, can you share your insights about the difference and why it's bad at dysbiotic biofilm?
Okay. The terms changed a little bit. It's not anymore the symbiotic biofilm, it's the eubiotic biofilm.
Oh, yeah, true.
Yes, and the eubiotic microorganisms are in balance. And of course, we need a lot of microorganisms which protect us against dangerous microorganisms. If this biofilm is modified into a dysbiotic one, we have a lot of bacteria which can produce which have virulence factors, and they can produce substances which are not good to us, which can damage a tooth surface. This is if they produce acids. This is caries. It might lead to caries. Or they can produce also proteases and other factors which damage our tissue. And therefore, the biofilm should be it should not be on places where it should not be, and it should be also in balance. It should be an eubiotic biofilm.
And how can we keep an eubiotic biofilm?
This is many people work on that. I think it is not so antibiotic. An antibiotic is touching everything and also an antiseptic. To keep an eubiotic biofilm, of course, it is the oral hygiene of a patient, which is of importance, that it has a good oral hygiene. It is a constant removal of the dysbiotic biofilm by the dentist or the dental hygienist. In addition, it might be something which protects us against the change within a biofilm. And this might be under discussion. I will see it's more or less it's theory or something is also working. This might be probiotics. It is under discussion, but here we do not know how long it would work. It might be also the development of substances which interfere with virulence factors, which block virulence factors and modify a biofilm in that way. And something which is also of importance is the lifestyle of a person, the nutrition, what the person is eating. This might influence a lot also the biofilm composition.
You talk about probiotics. We see a trend today in the dental field among oral clinicians that they are recommending more and more probiotics. But are we really working in the studies to show the benefits, or if they don't have benefits, or what is your opinion?
The opinion is that a probiotic is not each probiotic is not the same. There are huge differences between, and normally these probiotics were discovered by accident. It is just a large panel of some bacteria, and then people were looking on it.
Okay.
And we made also some research in our lab, and we found also that some probiotics which are within commercial available products of yogurts might work very nicely, but there we have no studies. And I think we should clearly look on the probiotics on the studies. I think a few are off the market that might work and others do not work. And the problem with probiotic is also what we do not have is a long-lasting effect. If you stop to intake a probiotic, it will probably change. And to my such opinion, there's also no studies which followed up for a long time, because the effect of probiotics is mainly the immune stimulation. You add a foreign bacterium to the body, and then it stimulates the immune response.
So, if I understood it right, always study what kind of biofilm you have, so to better target with the probiotic, but check also what kind of probiotic is working, it's not working.
Yes.
And but this is more to be used in a period of time, because the only thing that is really working is the mechanical removal of the biofilm.
For a long-lasting time, it is a mechanical removal of the biofilm.
Okay.
And I would think what also might work to a certain degree is a change of a lifestyle of a patient.
For sure. I think the change of habits is the most important.
Yes. The oral hygiene should be in a good way, and maybe it is also essential if somebody, we made many years ago a study where people changed the nutrition, and we saw good results also on periodontal indices. Okay,
good. So if I understood it well, change your habits, nutrition and oral home care.
Yes.
Do a professional mechanical removal of biofilm.
Yeah.
And check what is available in studies in terms of probiotics, and don't make a mistake to have a general probiotic to everything.
Yes. As I think it is still open question, and development not in dentistry. I have to make sure at the moment the development is going on a way that these bacteria are genetically modified.
Okay.
And this might be something maybe in the future that we add this positive bacteria to the body. I'm not sure. I have no knowledge about, nobody knows it, but I think it is something which might be interesting.
Okay. Tell me a little bit more about the book, because the book for me was so interesting. I learned so much with it. And interesting is that I still have it on my bedside, actually. Yeah, it's funny because sometimes when I have questions is when I'm going study, let's see if I missed something, and there's always something new. Why you build this book about oral biofilms? That's that's the interesting part. It's not oral biofilm, it's oral biofilms.
Yes. Because a biofilm is different. If you're looking on a biofilm which causes a periodontal disease, it is a difference from a biofilm which causes caries. And moreover, we have biofilms in if the pulp is removed. If we have an endodontic infection, we can have biofilms on a denture. And I think, in part, I like it to be more generalized, not to focus on a small thing, because you have some different, I would say, some general things. You have a biofilm, it consists of bacteria, it consists of matrix.
Yes.
And we do not know so much about the matrix of a periodontal biofilm. It's easy in case of caries, there's a lot of polysaccharides. In case of perio, we do not know so much.
Yeah.
And for me, it is a fascinating thing. And the other thing is, we have also biofilms if you go to the dental units.
True.
These are other bacteria, of course, which cause a biofilm. And for me, it's also fascinating things how bacteria behave in a biofilm, because they behave in another way than free floating. They are less active. It's a reason why antibiotics do not work.
And what was the goal with this book? Because you have a specific target here. Is to change a little bit the mindset. And here I'm talking really the dental-wise, from the common dental plaque to something that is more specific. Because like you said, there's different biofilms depending on the structure that you are treating.
Yes. Yes, it was to summarize the existing knowledge on this oral biofilms at all. That it's in an understandable way also for dentists, I think. This we tried at least to make it a little bit practical. And to give this overview from a general biofilm until the specialty. And then also to provide some, nowadays I would also add something more, but at that time what is available of treatment options.
And for you, know that you have done this summary. In your opinion, what's going to be the future on the management of oral biofilm? It's a tricky question.
Yes, it is a very tricky question. Yes, the future might be, it does not work, there are no study at the moment to interfere also with the formation of a biofilm. The adhesion, I think, does not really work. It is a little bit retarding the biofilm. We can interfere with parts which are of importance in the biofilm formation. It's a quorum sensing. Yeah. But here I checked literature recently. There is not so many things which are available. It's only very few studies regarding also periodontal biofilm. It might be the destruction of the matrix. It's an interesting point together maybe with something else which attacks the bacteria. And of course it will still be a better removal of the biofilm, maybe by better products which are more efficient, which can reach each area. I think still it will be a combination, because we have calculus and we have also the biofilm. And in my suggestion, both has to be removed. And then it might be also the modification of a biofilm, so that the biofilm is less virulent. This might be also a very interesting option, maybe by special compounds which interfere with the virulence of bacteria.
Yeah, that's the interesting part, because on my field I'm getting exposed so much ideas, and then we start testing stuff, of course, and something that is always coming to mind these last let's say these last 12 months is theories about the change of the biofilm.
Yes.
And this is being interesting, because having a less viral biofilm can really bring our goal, or that is to avoid disease in the future.
It is an interesting option, and I know that it's also some years ago that people worked with inhibition of most of the special bacterium. The problem, of course, is also that these compounds need to reach the biofilm, the bacteria within biofilm, and they have to work. This is something which is essential, and I think meanwhile there are something which is in the pipeline which might nicely work to interfere with virulence of bacteria. And it is interesting if we have compounds which interfere only with a few of the bacteria, which do not target everything. Like an antiseptic, it kills everything. This is not what we would like to have. We would like to have an abiotic biofilm that everything is in a good way.
That's super interesting. And I think for the next 5 years, maybe that's going to be the future. We're going to be we're going to see a lot of change in terms of how we handle the biofilm. But always, and I agree with you, it needs to be mixed. It needs to be a combination.
Yeah.
And the professional home care never gonna die. That's what we need to say to the listeners, because most of them, they are dental clinicians too. But to have a combination and to target specific virulent biofilm, let's say.
Yes, and this focus should be the bacteria which are associated with periodontal disease, which we would not like to have.
Yeah.
It is a question if, with an inhibition of virulence factors for a longer time, if we really can delete them or if we can make them, I would say, no, the term is not correct anymore, pathogenic, I would say.
Yeah.
Yeah, this is something which might be of interest.
This was really interesting. I really like this talk, and I hope to talk with you a little bit more after the podcast. But thank you again. So I keep in mind that the habits that we need to change, the mechanical removal and the combination is the most interesting to control, to manage the biofilm, and always check the probiotics before and target it.
I think probiotics, at least in Switzerland, they do not play an important role. It is only in some areas. And I think probiotics which work, it's not easy to get them. And it's also quite expensive for the patients. And I think it is not so nice.
Yeah.
Yeah.
And it's limited in the period of time. There is no long lasting, like you said.
It is not such a long lasting effect, probably.
Okay. Again, thank you so much. It was a pleasure to have you with us. For all the listeners, don't miss the next episodes of Smiles in the Air, and subscribe in any platform that you listen to our podcasts. It can be Spotify, Apple Podcasts, or even on YouTube. And don't forget, we have now all the podcasts, Season 1, Season 2, on our Swiss Dental Academy webpage. Thank you, and see you next time.